Thank you, Mr. Speaker. First, I want to say thank you to the good member from the 11th for working with me on this amendment. This amendment right now directs the Department, DSHS, to develop a plan and report back to this legislature by next year on how they might implement a pilot program within our RHCs, our Residential Habilitation Centers. As you know, Mr. Speaker, of our RHCs, 2 of them already are on the glide path towards closure. But all of the RHCs provide entitlement services to the residents there, including dental services. And so what that means through entitlements, like we discussed before, is that those residents are entitled to the support services such as dental services, and as we have a diminishing caseload at those facilities, we still have the dental facilities, including the dentist chair, the room, and everything else that those residents would require for dentists. However, we also at the same time have a growing caseload of residents in the community that can't access general services, but in particular around this item, dental services is a big barrier for those experiencing disabilities in our community. You may know this, Mr. Speaker, that one of the challenges among the developmental disability community is access to dental care that is really respective of their experience through the world. I can tell you personally, say with my 16-year-old son, he sees a dentist office, it's like he can smell it from 2 blocks over, and he's terrified of it. And it's not through any particular bad situation, it's just a concurrence of behavioral challenges mixed with the environment, mixed with a system of dental care in the community that maybe takes care of the middle 95% of the bell curve. Those on the extremes of the bell curve have a harder time. Those that require extra time, extra facilities, extra room, just a general understanding of how to work with the developmental disability community. It can be very challenging for a lot of people who experience this to find adequate dental care, and that ultimately results in behavioral health challenges that often go misdiagnosed or unseen. And so this amendment in particular says, while we have these facilities here, we would like DSHS to lay out what a plan would look like for provision of a pilot in these RHCs while they still exist, to provide some dental care services for those in the community that might need it. So it doesn't ask them to expand upon facilities or capital. It just asks DSHS to report back to this legislature what a plan would look like if they were to implement such a pilot program. Urge a yes.